My name's Dee, I'm 42 years old and I'm from Fremantle, Western Australia. My treatment involves 6 months chemotherapy followed by surgery, 6 weeks radiation and then continued hormone therapy. The type of breast reconstruction I had was a bilateral autologous DIEP recon. So I had the reconstruction about 12 months after my initial diagnosis, which was really good for me actually because I had a lot of time to think about different options and the type of reconstruction that I wanted. I had read somewhere that patients that were able to research into their options were more satisfied with the reconstruction that they had. So even though a lot of me wanted just to get the reconstruction done straight away and move on, actually waiting for a long time has done me well because I just feel more comfortable with my choice. When I was first diagnosed, it was horrendous, as you could imagine. I think I went through all the stages of grief, starting at despair, and eventually I feel like I'm in a space now of more hope and gratitude for the treatment that I've been able to have. But at the time, it was, time stops. So leading up to the surgery, I had the benefit of time, so I did a lot of research into different options. Once I'd figured out the type of surgery that I wanted, I was able to talk to lots of different surgeons, which really helped until I landed on the one that I felt really confident with. I found a few people that had been through similar experiences, so it was really helpful to talk to them. Above all, probably I did a lot of work with my breast cancer psychologist, and I feel like that was the most useful for me in terms of preparing myself mentally and emotionally. When I was first recommended that type of surgery, the DIEP, I was terrified, but through working with psych on it, it just gave me a lot more tools to use to reframe it more as as like a positive bookend, I guess, to the cancer journey. So I guess that has been the most help. Other things are more tangible, I guess, or the blood tests or the the PET scans and that kind of thing that you have to get done are pretty standard. But yeah, I'd say probably the psych help has been the most helpful, and doing research on the right type of surgeon. So immediately after surgery, when I woke up, it was quite full on. It is major surgery. There's no sugarcoating it. It is confronting. I think at one moment I counted 17 tubes coming in or out of my body, which sounds more terrifying than it was. At the time, it didn't feel scary. I was more scared about it leading up to it, but when actually in it, I felt very safe. I felt very cared for. My pain was really well managed. I used a Zimmer frame for the first 3 or 4 days to get around, which I think gave me a lot of empathy for older people and people with mobility issues because it's really tough. And then I was able to leave all the drains at home at the hospital, which was great. So I just went home with one vacuum pump that was helping keep the stomach wound together. And I only had that for a few days at home, and then a nurse came and checked on my wounds and got them removed. I had follow-up appointments with the plastic surgeon. I had really great contact with one of the nurses who I could text message and ask random questions about when I could swim and if I could show her photos of what a wound looked like, and she could tell me if that was okay or not, which was really gave me a lot of confidence that I was okay, because otherwise it's really easy to spiral. Yeah, it was relatively easier recovery than what I anticipated. I really planned for 6 weeks recovery, and I feel like I was back to semi-normal 2 to 3 weeks later, which was great. I got to spend more time with my family and enjoy things. After the surgery, I did go and see a physiotherapist who gave me some exercises to strengthen my arms, which was helpful, and just checking for any lymphedema, because I'd had auxiliary clearance, so I just needed someone that knew what they were looking for to check me to see if I was okay. Apart from that, I did have a plastic chair in the shower. I could stand in the shower probably after a week, but it took a little while to have confidence to do that. I couldn't drive for a while, and I had a compression brace, which was actually quite comfortable, and a compression bra, which I wore for 6 weeks. And it was fine. Looking back on it now, it was fine. I'm sure at the time I probably had a different story, but overall it was very small in the grand scheme of things, I feel. I had a revision surgery just last week, literally 5 days ago. I had it to improve shape of the breasts and improve symmetry. It was fine, like compared to the first surgery, which was a major surgery. This was a minor surgery, so it was just 1 night in hospital. I think I probably did underestimate what going back into the hospital system was going to be like, and if I was speaking to someone else going through the same thing, I would always say reach out to your anaesthetist and talk to them if you're feeling nervy, if you've got any anxiety, because it's good to know that someone's got your back if you're freaking out, even when it's minor surgery, because I think after the cancer experience there's a lot of trauma there that you may not be aware of, and so just telling your care team what's going on with you means that you'll be better cared for. But overall, I mean, I'm back at work. I was back at work yesterday. It's been pretty carefree, really. So my initial DIEP surgery was about 6 months ago. I'm feeling great about it. I had a long period between cancer and the surgery of having one breast, and that was weird, but it's crazy how quickly you get used to things. And then when I had the DIEP surgery, the recovery, after that was done, I'm not sure if I said before, but it feels like a really positive thing to do at the end of this whole gross cancer thing, where you lose your identity, you lose your hair, your eyelashes, your eyebrows, your boobs, like you just become a cancer patient. And then to be able to get your boobs back in a way that you want them to be just opens up. For me, it meant I could wear outfits that I never would have considered before. It's been a really lovely way for me to reclaim my life back a bit, which, could be vain, but I think there's a lot in that. Like, breasts mean a lot more than just physical appearance. So yeah, for me it was really, really important, and I have absolutely no regrets doing it. It's been really helpful for me. For women thinking about breast reconstruction, I would say do your research, look at all of the options, even if you know you don't want to do some of them, just look at them and understand what they are, and make sure you're clear on your reasons why you don't want to do that. Speak to multiple surgeons, get lots of different points of view. Try and find someone that you can speak to that's gone through the surgery, and just hang in there. The body is amazing and recovers from so much, and it's amazing how quickly this kind of surgery can feel so natural really, really quickly. I feel really good right now, I've just had revision surgery, so I'm excited to see how things settle down. I'm still a bit swollen, so it kind of takes a while for things to find their place, but yeah, I'm really excited. I'm going to be able to wear I've even got the amazing dress picked out that I'm going to wear for all my Christmas parties this year. So yeah, I feel really great. I feel really excited.